Your body often whispers before it screams, before the fever, before the cough, before you say, I think I'm getting sick. At 2:14 in the morning, while a person is still asleep, a tiny sensor on the wrist quietly watches the body change. Heart rate rises, sleep becomes restless, skin temperature shifts, breathing changes by a small amount. By sunrise, the app sees a pattern, and that pattern may be the first warning that the immune system is already fighting something. This is the promise of a new generation of health devices, not just tracking what happened yesterday, but noticing what may be starting inside the body today. But here is the dangerous part. A device can notice a signal. It cannot always understand the story. So can a smartwatch, smart ring, or wearable sensor really predict illness early? Research suggests that changes in resting heart rate variability, sleep, respiratory rate, oxygen levels, and skin temperature can sometimes appear before symptoms become obvious. During COVID-era studies, scientists found that wearable data could detect unusual body patterns before some people reported feeling sick. That sounds powerful, but it also raises bigger questions. What is proven? What is early research? What is just marketing? And where is the line between useful health awareness and unnecessary panic? Because the most powerful feature is not the sensor, it is the baseline. And near the end, we will reveal the one mistake most people make with health gadgets, a mistake that can turn helpful data into fear, false confidence, or delayed medical care. Most people do not notice illness when it begins. They notice it when it interrupts life. A parent wakes up tired and assumes it is stress. A student ignores a high resting heart rate before an exam. An office worker sleeps badly for 3 nights, then suddenly wakes up with a sore throat. The body was sending signals, but the signals were quiet, scattered, and easy to dismiss. Traditional healthcare is powerful, but it is often reactive. You feel symptoms. You book an appointment. A doctor checks your signs. Maybe tests are ordered. But between normal and clearly sick, there is a hidden zone. That is where wearable health technology enters, not as a replacement for doctors, not as a magic diagnosis machine, but as a personal early warning system that watches patterns over time. Here is how the device works. A smartwatch or smart ring usually contains tiny sensors that shine light into the skin, detect blood flow changes, estimate sleep, and sometimes track skin temperature or blood oxygen. Motion sensors also help the device understand movement and rest. The app then builds your normal pattern, your usual resting heart rate, your normal sleep timing, your typical breathing rate, your usual skin temperature trend, your usual recovery after exercise. This matters because one person's normal is not another person's normal. A resting heart rate of 58 may be normal for one person and unusual for someone else. A small temperature shift may mean nothing alone, but with poor sleep, higher breathing rate, and lower recovery, the pattern becomes more interesting. The device is not saying you have the flu. It is saying your body is not behaving like it usually does. That difference is everything. Established fact, wearables can measure or estimate several body signals continuously or repeatedly. Research finding. Some of those signals can change during infection, stress, poor recovery, and other health conditions. Early stage finding. Algorithms may help detect unusual patterns before symptoms in some cases. Marketing claim. Some products describe these alerts as early signs of sickness or strain. Medical reality, a consumer device cannot fully diagnose the cause without clinical context. So what does the science actually say? In one Nature Biomedical Engineering study, researchers using smartwatch data reported that physiological changes linked to COVID-19 could be detected before or around symptom onset in a portion of participants. The signal was often based on unusual elevations in resting heart rate compared with a person's own baseline. Another large study using wearable and symptom data found that smartwatch and activity tracker information could help distinguish symptomatic COVID-positive participants from symptomatic COVID-negative participants. That does not mean the device diagnosed COVID by itself. It means the data added useful information when combined with symptoms and testing. This is important. The evidence is strongest when we talk about pattern detection, remote monitoring, and alerts that something may be changing. The evidence is weaker when we talk about predicting one exact illness with perfect accuracy. Doctors and researchers are interested because continuous data can fill gaps between clinic visits. Remote patient monitoring is already used in healthcare for things like blood pressure, glucose, oxygen levels, weight, and chronic disease management. But consumer wearables are not all medical devices. Their accuracy depends on sensor quality, placement, skin contact, movement, algorithms, and the type of measurement. A chest ECG patch, a clinical thermometer, a lab test, and a smartwatch do not carry the same level of evidence. And this is where the story becomes more complicated. Used wisely, this technology can be genuinely helpful. Imagine your device shows that your resting heart rate is higher than usual, your sleep was broken, and your temperature trend is elevated. You do not panic. You pause. You reduce intense exercise for the day. You hydrate. You sleep earlier. You avoid exposing vulnerable family members if you also feel symptoms. You monitor how you feel. And if warning signs appear, chest pain, difficulty breathing, fainting, persistent fever, confusion, or dangerously low oxygen on a reliable device, you seek medical help. That is practical health intelligence. For a fitness beginner, poor performance may not mean weakness. It may mean poor recovery. For a busy worker, rising stress and lower heart rate variability may become a reminder to rest before burnout hits harder. For someone with a known health condition, connected devices may help a healthcare provider see trends between appointments. The best use is not obsessing over every number. The best use is watching trends, knowing your baseline, and connecting data with real symptoms. But the real danger is not what the device shows, it is what it misses. A normal-looking dashboard does not prove you are healthy. Some illnesses do not create obvious wearable signals. Some people have serious symptoms, even when the device looks calm. False confidence can be dangerous. There is also the opposite problem: false alarms. A hard workout, alcohol, poor sleep, dehydration, anxiety, travel, heat, or a loose strap can change your data. The app may flag strain, but the cause might not be infection. Blood oxygen readings can also be imperfect. The FDA has warned that pulse oximeter accuracy can be affected by factors such as poor circulation, skin pigmentation, skin thickness, temperature, tobacco use, nail polish, and sensor placement. Wrist-based readings may be even more sensitive to movement and fit. Then there is health anxiety. Some people check the app again and again. A lower sleep score ruins their morning. A slightly high heart rate becomes a spiral. The device designed to create awareness starts creating fear. Privacy matters too. Health data can reveal intimate patterns: sleep, stress, location routines, exercise habits, and possible medical concerns. Before trusting any device, check what data it collects, where it stores it, who can access it, and whether it can be shared. And marketing can blur the line. Predict illness sounds dramatic, but responsible interpretation is more humble. The device may detect unusual physiological changes that could be linked to illness, stress, recovery, or something else. That is useful, but it is not the same as a diagnosis. The future is not one device telling you everything. It is a connected ecosystem. A smart ring notices poor recovery. A glucose monitor shows how meals affect energy. A blood pressure cuff sends readings to a clinic. An AI assistant helps organize symptoms into clear questions for a doctor. A hospital monitors high-risk patients at home before they deteriorate. In the future, AI may compare your data to your own history, medications, environment, and population-level patterns. That could support more personalized care, but it also creates ethical questions. Who owns the data? Can algorithms be biased? Will people without expensive devices be left behind? Can companies profit from fear? Can doctors handle thousands of alerts without overload? The best future is not humans versus machines. It is doctors, patients, and technology working together with clear evidence, strong privacy, and honest limits. The device that predicts illness early is not really predicting the future. It is listening closely to the present. A warmer night, a restless sleep, a faster pulse, a breathing pattern that changed before the person noticed. Small signals, quiet signals, human signals. Technology can measure the body in ways we could not measure before, but wisdom is knowing what those numbers truly mean. The future of healthcare may not begin inside a hospital. It may begin quietly, on a wrist, around a finger, beside a bed, or inside a simple device that notices the body trying to speak. But data alone cannot protect us. Only understanding can. Health technology is not magic, it is a mirror. And what matters most is how we learn to read it.